Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you so much for joining us for this webinar, which highlights Axxess's new integration with Hospice Pharmacy Solutions. My name is Laura Barnett. I'm on the marketing team at Axxess. Before we get started, I'd like to tell you a little bit about Axxess. We'll share more in the webinar itself, but just to level set for everyone, we're a leading technology company serving organizations that provide healthcare in the home. We offer a complete suite of easy-to-use, innovative software solutions that empower hospice, home health, and home care providers to grow their business while making lives better. If you have a question during today's webinar, please submit that through the chat box. If we have time at the end of the webinar, we'll get to those. And if we run out of time, we will certainly follow up with you after the webinar. We certainly want to make sure that you get those questions answered. Today, you're going to hear from two hospice experts. You'll hear from my friend and colleague, hospice expert Tim Ingram. Tim has experience both on the hospice provider side as well on the software side. He brings about 2 decades of hospice expertise where he shares our solution with hospices nationwide. And joining him is Corey Petrie. He leads the sales team at HPS. Corey has spent his entire career in the healthcare sector and now helps hospices deliver better care more efficiently through the use of a pharmacy benefit manager. Tim and Corey, I know you guys have a lot to cover, so take it away.
Yeah, so today we're just going to, the goal of today was to really introduce HPS, as in our new integration with Axxess. So I'm going to give a brief overview of that. Tim's going to give an overview briefly on Axxess, and then I'm really going to get into the meat and potatoes of the presentation, which is, why is it important to have a PBM and the benefits of a PBM? And then also really the efficiencies in the workflow that are obtained by setting up an integration with the EMR, in this case, Axxess. And then if there are any questions, we'll try to take those at the end. So HPS is, just to give you an overview, we are part of a shared service company called Care Services out of Raleigh, North Carolina. And really within our portfolio of companies, we have 4 divisions that service various sectors of healthcare. And very briefly, the first 2 are in long-term care, which is called MedCall and JuryScript, and they really are a backup PBM for long-term care institutional style pharmacies like PharMerica and many others. We also have a division that does correction pharmacy needs. We currently service a lot of state and federal institutions around the country. When prisoners are going in, they can't obviously bring their medications into these facilities, so they have to get new medications as they go in and then new medications as they go out. So we help them in the adjudication and in the release of those medications. And then there's us, there's Hospice Pharmacy Solutions. We're a national hospice PBM. That's all we do is hospice over here in our division. We service about 550 locations around the country and have been doing this since the year 2000. And then the last division is our general delivery division called Complete Delivery Solutions. And this was an organic division that was created several years back. And the purpose of this was to really it acts very similar to like Uber for delivering medications from a pharmacy to a facility or a patient's home. And it's one of our fastest growing divisions, as you guys know, in today's world. We want everything delivered. So Complete Delivery Solutions is, filling that need for us. And like I said, it's growing very quickly. So with True360, this is really our culture of what we do and the pillars of success. And we have a client advisory council that consists of about 12 to 14 individuals that are from all types of different customers that we have. And we meet with them on a quarterly basis. And then face-to-face, we do a retreat once a year. And they really helped us, develop our True360 program that talks about the partnership with our hospices, the customization that we provide to meet their needs, and really the service and what we do. And there's the 5 pillars of true partnership, where we're using collaboration, it's powered by people and it's driven by your data. Compliance, we have individuals within our organization that stay up to date on all the ever-changing CMS regulations that are being bestowed upon hospices and home health. So keeping you compliant The next one would be efficiencies, which we're going to talk about today, which is really improving the workflow and the touch points that you have to have with the, if you're doing something in your EMR, that should flow seamlessly over to your pharmacy. Network, we obviously have a national network that we built for hospice. We have 65,000 pharmacies that we have in our network, but within that 65,000, we drilled that down to just a few thousand that really do hospice, and that's what they do. These pharmacy owners, the people that run these pharmacies, they really, have it in their heart to do hospice, and they have built their infrastructure around doing hospice medications. And then the last piece, and really an important piece, is education. We provide a lot of education to our hospices to empower their nurses, to provide seamless onboarding. We provide CE education to all of our clients on a monthly basis through our Pathways to Success webinar series. So,
yes, thanks, Corey. I'll take over for a minute. And so very briefly, sure, just as Corey did with HPS, I am going to give a very brief overview of Axxess. There's a lot of things that we could say about who we are as an organization and what we provide, the solutions and the services that we provide. But as a very brief overview, it might be easiest to talk about our history. And we began in 2007 as a healthcare consulting company. And our CEO and founder, John Olajide, saw a need for consulting from a technological standpoint, and that's where his education came, and he had family that worked in healthcare at home and became very interested in that, and literally, since he graduated, has led the efforts at Axxess, since he graduated college, has led the efforts at Axxess for us to help the industry, first as a consulting organization, and then in 2011, we launched our comprehensive cloud-based solutions, and Corey will refer to us as an EMR throughout this presentation, but we really provide more than just an electronic medical record. We are a complete suite of solutions. And so beginning in 2011, we became a solution for home health organizations, a solution for private duty or home care organizations, and most recently, a solution for hospice organizations, with that solution being built from the ground up by hospice experts for hospice professionals. And so here we are in 2020, and looking beyond, we believe deeply that the future of healthcare is in the home. And so what we do is exactly what's listed there on the screen. We are advancing innovative healthcare solutions, and our partnership with HPS, Hospice Pharmacy Solutions, is exactly that. It is a way that we can advance innovation for the healthcare at home industry. And at Axxess, we are a very vision and mission driven organization. And what you see on the slide now in front of you is our integration specific vision and mission. But I'd like to speak briefly before I get to that about our vision and mission as a company. And so all of our teams within Axxess have a team specific vision and a team specific mission, but that is all underpinned by our Axxess foundational vision and mission. And so our vision at Axxess is to be the most successful global healthcare technology solution, most admired for its people, partnerships, and solutions. And those words are very intentional. Even the order is intentional. We cannot have solutions unless we have partnerships, and we cannot have partnerships without people. And so that is our vision and really drives everything we do on a day-to-day basis. And then our mission at Axxess is to empower healthcare organizations and professionals with the world's best technology solutions. And then that feeds into this vision and mission you see now. And that is, from an integration standpoint, we want to deliver a fully integrated, seamless set of solutions for healthcare organizations and be the most preferred industry partner. And while Corey and his team works with a lot of EMRs, our hope is that we are the most preferred because of how easy it is for the HPS team to work with the Axxess team. And then our integration mission is very similar to the Axxess mission. It is simply to empower healthcare organizations with the most seamless, integrated technology solutions. And so, Corey, I'll turn it back over to you now.
Thank you, Tim. Thank you. And I will give you, Tim, a shout out. As far as you're right, we do work with a lot of the EMR EHRs within the hospice space. But what I can tell you is with our connection and integration with Axxess, the speed in which we are able to stand up customers and also the accuracy of that information is unparalleled. I will say that.
Thank you, Corey. Thank
you. You got it. So when I talked a little bit about the True 360, and this slide really embodies kind of the holistic approach to not only managing, it's really three main areas. It's the clinical engagement and what we do to really collaborate with the hospices to find out what their goals are, where their process pain points, what they would like to achieve. Us, obviously providing best practices because we do service, now nearly 24,000 patients a day. We have a lot of, we obviously have a lot of data to pull from. So it really boils down to the clinical engagement, the staff experience, which that's really what we're going to focus on today, is really reducing the workflow, the workload, and improving the workflow. And it's just the ease of doing business. And then the last piece would be the financial health. Of course, reducing costs in today's environment is very important, but we want to provide the tools to the hospice so they can make the decisions to reduce their costs. But ultimately, our goal is to provide the best outcome and patient care that we can. So first step, what we do is we have this is our hospice support team. So every account that we bring on gets assigned a dedicated account manager. This individual is going to be the primary touch point for that hospice. Anything that they need in regards to reporting or invoicing or anything, it's that kind of one throat to choke type person, right? So you have your account executive, and this is who you would go to on a day-to-day basis. We also have a team in Dallas. We're also based in Dallas, and our customer service reps reside there. Every single customer service rep within our help desk is also a pharmacy tech, so that they're available 24/7, 365 on every major holiday. We're always open. We have 10 pharmacists on staff, and every account is assigned a pharmacist that will. And their role is to provide the consultations back to the hospice, provide utilization reviews, talk about medication interactions. But we always have a pharmacist available. We have pharmacists in the office from 7 to 7, but there's always a pharmacist available on call. So we got you covered. And the last piece is an executive sponsor, and this is something we started a few years back, and it's been highly successful. And what we'll do is we assign someone from our executive team as an executive sponsor to be part of the quarterly business reviews with that account. Someone that you have their phone number, their email, you built a relationship with, that is on the executive team. So if you need to reach out to somebody, you have a relationship and you have a way to get to that person quickly. So this is an example of one of the things from a clinical standpoint that we do for all of our clients. And I know this is a very busy slide, but what I want you to take away from this slide is if you look down on the left side, this is a clinical roadmap. And after a client has been on our service for about 60 days, 90 days or so, we have some data coming in. What we do is we develop a roadmap for them. And it's really a way for us to identify various areas of cost and clinical opportunities. And there's some that are easy to do. They're kind of the low-hanging fruit. There's some of these initiatives that may be medium to hard, and then there's some that are a little bit harder, but they all have a financial impact on the ultimate PPD. And it's also a way for us to get buy-in from the hospices. Okay, here's what we see. Here's the potential annual savings on a PPD and from a financial. Now, obviously, this one was done for a very large hospice, probably, I'm guessing somewhere probably north of 1,000 patients. But we do this for everyone, and we'll tell the hospice, here's the initiative, here's what we need to do. This would be the impact of the hospice, and here's your potential maximum savings, and then your estimated PPD reduction. And the reason we estimate it is because we know that it's very difficult to do every recommendation. It's virtually impossible. It's kind of a pie in the sky look. But what we normally see is about 50, sometimes 60%, somewhere it's usually between 50 and 60% of our recommendations can be implemented into the hospice on a day-to-day basis, which has really led, in our entire book of business, Since January of 2019, we have reduced our entire company's PPD by 22%. And we've done that by implementing programs like this and really having champions within the hospice that help us drive these recommendations, which has just been fantastic. So kind of, rolling off of that, the true advantage of HPS is a few areas. It's the financial. We will reduce spend by keeping score, doing these roadmaps, talking about them on a monthly basis, and really help driving initiatives. The clinical services. I mean, having a team of hospice pharmacists who have been in the hospice and geriatric pharmacology for many, many years, they act as an extension of your hospice. Staff experience, which I'm going to get into here just in a minute, which is improving the workflow. We have, as far as our network and our pharmacies, almost all of the medications that are delivered to patients on our service come from local pharmacies that are within the communities that you service already. However, we do know that some hospices, like for instance, we have a customer out in Colorado that has patients up in the mountains, and really having local pharmacies deliver is really not the best option. So we have mail order options available as well. So we have relationships and contracts with various mail order pharmacies, the West Coast and Southeast and Northeast and on the East Coast, that also can mail medications to the patient's home within a 1 to 2 day period as well. But the vast majority of our customers really enjoy the local pharmacy connection because it does allow them to build a relationship with their local pharmacy, as well as they can get the medications generally in the same day if they're ordered before the delivery cutoff. And then the last piece would be the account management team of just having a deep engagement and involvement within that hospice to help them achieve their goals. And they kind of act as your partner in helping you, do all the legwork of the integration and bringing proactive information back to the hospice so that they can make those improvements. So the benefits of connecting with organizations like Axxess. So this is what I want to talk about here. So for the purpose of a pharmacy interface, there's really 3 modules of information. So when we connect with an Axxess customer, when we connect with Axxess for providing improved workflow, these are the 3 modules of information that are going to flow back and forth. And the first one is the CMS billing information, sometimes referred to as the CR 8358. And what we do is all of the claims that come in throughout the month, what we'll do is we put those in a format that's provided to us by Axxess. It's scoped out to their specs, and then we import that information back into the system for the purpose of billing. And this really improves for organizations that don't have this. They usually have to have an individual typing those medications in, and it's 12 columns of information for one claim. So depending on the size of the hospice, we've went and met with hospices that had teams of people doing this for sometimes 3 and 4 days. Obviously, a smaller hospice could probably get this done in half a day, but regardless, it's still a lot of man hours of typing that information. So our partnership with Axxess, we're able to scope that out. We do it electronically, and it's an import, so it really saves the hospice a lot of time. The last 2 modules are very important in the ordering of medications. The first one being the ADT, or the admission, discharge, and transfer fee. This is essentially the demographics of the patient. So what this allows you to do is eliminate the need for any kind of calling or faxing or putting something in a portal. You just do the normal workflow as you would normally do in Axxess, and that information just flows over to us in real time, and the patient is admitted into our system. As well as any change that you make on that patient's profile in regards to, adding or removing a medication, we get that message as well. It trues up in our system. So we're always going to be in sync with what's in Axxess. And then the last piece is medications. And this is probably, when you talk about pharmacy integrations, this is the most important piece. So all of those medications that you're profiling into the patient's into the system and Axxess, all of that information comes over to us. And then what we can do with that information is we're ready to go. It hits all of our edits. So we have the patient's demographics. We have all their medications, covered, not covered. We're set and ready to go, as well as if you're using us for your e-prescribe, we also move those medications into our e-prescribe application so that you can seamlessly open the app on your phone or tablet or computer and prescribe the medication and send it to the pharmacy of your choice. So it's a very seamless flow of data. And like I said, with Axxess, they're very easy to work with. We typically get these set up it takes us about 30 days to get all of this scoped out. We do testing in a sandbox, and then we go live. So this is just a general kind of workflow. I've already kind of talked about this, but this just is kind of a very simple way of just to think about how the information flows from the EMR, from Axxess over into the dispense. So you have a patient event in the system. It comes over into us. They send it through an HL7 message over to us. It hits our edits. So, you'll have things like, you may say, well, listen, we want to have a prior authorization for any drug over $200, or we also want it to hit our formulary. So we'll have all of those edits in our system. So when that information flows over to us, if a medication is ordered that hits one of those edits, it's going to prompt a prior authorization. And the big reason for that is really to improve just the behavior that, if maybe the medical directors or the nurses have said, okay, well, this drug is in the same therapeutic class as this medication's on our formulary. Sure, let's use that one. And then over time, those prior authorizations reside. And then, of course, you can e-prescribe and or fax or call the pharmacy. Of course, a lot of states, with hospice allow the nurses just to call in a verbal order. So, the getting the medication to the pharmacy will still be done in its normal way. And then the medication is dispensed to the patient either by, the family picking it up or it gets delivered. So this right here just talks about a little bit, I touched on e-prescribe. So with Axxess, customers that are with Axxess, we're taking that information, it basically flows over to us, and then we put it into our proprietary system called RxConnex. And that allows us to connect with Axxess and also into our e-prescribe product. And it's a very seamless transition. We did some surveys last year, and what came back is by implementing these systems, nurses were saving approximately 20% of their time in regards to pharmacy-related tasks that they were doing prior to having this. So you could do the math, saving 20% on these types of things really adds up in a soft cost. So, and then with Axxess, like I said, we have a dedicated EMR integration with them. There's really no additional training or anything that's needed because it's the normal workflow that you do on a daily basis with Axxess. And then the last piece is, electronic reporting and analytics. I don't really have any slides in here to show all of that because it's probably a whole nother meeting. But, all of this information is going to flow into these, a real-time dashboard. So all of the claims that are dispensed to a patient on a daily basis, at the end of the evening at midnight, all of those claims will close. So every day when you come in, you will have real-time reporting on what your PPD is, where your high-cost medications, your opioid laxative report, all the COPS reports, everything is done in real time. And then we also have a set of what we call our standard 8 reports that your account manager will send out to you either on a bi-weekly basis or monthly basis. So this is just to kind of, it talks about RxConnex. I kind of already touched on this. One thing I will say about RxConnex is what this allows you to do is it really improves the life for your medical directors, because when they can really prescribe, the normal workflow is done in Axxess, and they can just, it could be in the middle of the night, they can just, they get a ding on their phone that they have a prescription, maybe they have a C2 that needs their approval. It dings for them that you have a prescription that needs your attention. You open the application, you sign in, you review it, and then you can send it on into the pharmacy. So there's no need for any, writing a script or faxing or anything like that. It really improves the day-to-day. So Tim, that's really the overview of the integration with HPS, and we could open it up for any questions that people have.
Yeah, and Corey, thank you. I want to make sure everyone is able to capture. We'll leave this slide up until we finish the webinar here in just a minute. I want to make sure everyone is able to capture the contact information, and if you attended, you'll have additional information that will be available to you after this. And as Laura said, we will gladly answer any questions that you may submit that we don't get to right now. And if we miss any questions, it's always a fear of mine that we'll miss in the chat some questions that someone has submitted. And so if we miss any of those, we will make sure to follow up with you after this webinar is over and get your questions answered. So Laura, I think for now we'll turn it back over to you and ask about questions and see what we need to do before we finish.
Great. Thanks, gentlemen. I appreciate it. I'm not seeing any questions pop up on my end. However, as Tim said, we'll certainly keep that up in case you did ask a question and I don't happen to see it. Please do reach out to us. We definitely want to get your questions answered and ensure that you walk away with the information that you need. We'll also be emailing everyone who's registered to this a link to the presentation as well as this recording. So you can share this with your colleagues or your friends who might find this valuable as well. I want to thank Tim and Corey today for their time and their expertise. We're really looking forward to this partnership. We know that Axxess Hospice is growing into a really robust solution, and that's thanks to key partners. We're really delighted to partner with HPS on this, and we know that this is going to make caring for hospice patients easier and better and more efficient. So we're really grateful for your partnership. And we certainly want to thank you as well. We want to thank our audience for joining us today. We know that you're busy, so we appreciate you some time during your day today to learn a bit more about this partnership and this solution. We want to thank you for joining us as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. We hope you have a fantastic day. We'll talk to you soon. Goodbye.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.